Listen to this. A condition once considered to be a normal issue during hospitalization is getting a lot of attention over the past 2 decades because some say it may be completely preventable. I'm talking about a sudden form of organ failure known as delirium in the ICU. Here to talk more about this from UC San Diego is Dr. Biren Kamdar. Welcome.
Thank you.
I absolutely appreciate getting to talk to you because I've never heard of this before. So first of all, explain, what is delirium in the ICU?
So delirium in the ICU is something that we didn't really know anything about 20 years ago. We would have patients who were confused, agitated, out of it, very disoriented to their space and surroundings, and then they finally started to define what it was, and they found that it was actually delirium. And delirium is something that happens suddenly, usually in the intensive care unit, but it can happen in any patient in the hospital. It's up and down in terms of the brain function. People can be confused, they can be paranoid, they can have delusions, they can feel like people are trying to harm them. It's very scary for the patients.
And then it can have long-term effects in addition to elongating their hospital stay too.
So we've learned many things about delirium in the past 20 years. One, that if you have delirium in the hospital, you're almost guaranteed to have problems in the hospital, a longer stay in the hospital. If you're on a ventilator in the ICU, the patients that I take care of, there's a likelihood you're going to be on the ventilator longer. And if you survive the hospitalization, these patients often will have severe impairments with their thinking, so cognitive impairments. For some reason, the brain is connected to the muscles, so people also have physical impairments. And we also know that people also have a chance of ending up in healthcare settings longer term if they have had delirium in the hospital.
So this was really important to get a handle on. And you've learned, you have some takeaways that this may be preventable.
So the first part of delirium prevention is detection. So delirium is an organ dysfunction that is somewhat invisible. There's no blood test for it. Patients often look like they're lying comfortably in the bed, sleeping, but on the inside there can be a thunderstorm going on in the head. And so what's important is that we identify it at the bedside. We have ways to do that with very short, quick diagnostic tests. And we also are trying to work on alerting families to the problem. Nothing can be more disconcerting for a patient than to feel disoriented and the family is sometimes sitting on the couch on their phone or whatever, just trying to stay out of the way. But now we're pulling families in and saying, you may be able to help with this. You may be able to orient your loved one. You may be able to bring their brains back and orient them to the news and other things that they're interested in. So those are things we're working on with prevention. So first is detection, and then as far as prevention goes, we've identified some risk factors for delirium, the main one being medications that can possibly be causing this brain dysfunction. So the first thing we look at is the list of medications that the patient is receiving. We try to decide if there are things that we may be able to discontinue or hold to see if that may clear things up. We know that prolonged bed rest may also be a risk factor, so people are often laying in bed while they're recovering from their illness. Maybe we can get them out of bed and move them around, get them in a chair. San Diego, we have an advantage with sunshine, so I try to get my patients outside. So these are things that we have to think about.
Okay, so if somebody wants to, because there's so much more to talk about, unfortunately we get so restricted with time, but where we go from here, what's the takeaway for our viewers?
I think the big takeaway for the viewers is that this is a major problem. It's been defined as a major health problem. It happens to the majority of patients in the ICU. It's very common in the hospitalized setting, and so awareness is key. And if you're thinking about it, please talk to your providers about it.
And I know that there's a direct correlation between the sleep cycles we were talking about and possibly inactivity in the brain, and that's something you're looking into, correct?
So I'm currently funded by the National Institutes of Health to actually try to unravel the relationship between poor sleep in the hospital and delirium. We think there's a connection, but we have a lot of work to do.
And I would love to have you back to talk more about that, okay?
Would love to.
All right, thank you so much.
Thank you.
Amazing, Mark, everything that our brains can be impacted by, right?
Unbelievable.
Yeah.
Haven't even really scratched the surface
Exactly.
yet.
Yeah, we have no idea how the muscles are talking to the brain.
Yeah, it's unbelievable.
But if
It
they're
really
going to
is.
figure it out, they're going to figure it out at UCSD. I know it, right?
You're right.